Hi students, today we are going to see about health promotion model. So this is a continuation of health illness model. So last class we have seen about health belief model, and this health promotion model, it was designed by Nola J. Penter to be a complementary counterpart to models of health protection. So this is also a similar model of health protection. So we are going to see about the definition. Health promotion model defines health as a positive dynamic state rather than simply the absence of disease. Health promotion is directed at increasing a patient's level of well-being. So according to this model, health is a state of simply the absence of disease. Rather, it is a state of complete well-being or a higher level of well-being. Next is about the model. Here you can see the model. Students, you are supposed to draw this model and you are supposed to learn this diagram. So in this diagram, first of all we are going to see about the three areas of Penter's model. So the three areas are: first area is the individual characteristic and experience, second is the behavior specific cognitions and affect, and the third area is behavioral outcomes. So first is about the individual characteristics and experience. So the theory notes that each person has unique personal characteristics and experiences that affect subsequent action. So here we are in the part of nursing assessment, that we are assessing the characteristics of an individual and about his prior experiences. Second is the behavior specific cognitions and affect. So here you can see the set of variables for behavior specific knowledge and affect have important motivational significance. So we are understanding about there are a set of variables that determines the health promoting behavior of the person, and these variables can be modified through our nursing actions. And the third area is the behavioral outcome. Health promoting behavior, that is the desired behavioral outcome, which makes it the end point in the health promotion model. So we will see, we have seen the major areas of health promotion model. Now we are going to see the major concept of health promotion model. I want to explain this major concept from this diagram. So in this major concept, first area is the individual characteristics and experiences. So this individual characteristics and experiences, you can see first is prior related behavior. For example, if we consider a person with post myocardial infarction, we are assessing like previously whether he experienced any angina pectoris or other symptoms of coronary artery diseases, and what all modifications, risk modifications he done, whether he is aware about this risk modifications. So that is the prior related behavior. Second is personal factors, or that is biological factors, psychological and socio-cultural. So with the help of our initial assessment, we can assess the personal factors. First is biological factors, that is the while doing the physical examination, we can assess the body mass index, weight of the person, agility, his physical status and all. Second, psychological, his psychological conditions, self-esteem and all. Next is socio-cultural factors, his race, ethnicity. So that is the first part, that is assessing the prior related behavior and personal factors. So the next part is behavior specific cognitions and affect. So here the person with post myocardial infarction, we are advising the person for certain risk factor modification like dietary modification and regular exercise. So, here in this part, perceived benefits of action, that is the anticipated positive outcomes that will occur from health behavior. So, after a dietary management or after an exercise, the person is understanding, yes, what are the benefits I will get by doing this exercise. Next is perceived barriers to action, that is the anticipated, imagined or real blocks and cost of understanding a given behavior. So, here the person is identifying, yes, these are the barriers to do the risk modification like time or climatic condition to do an exercise or other such type of supports. Next is perceived self-efficacy. It is the judgment or personal capability to organize and execute a health promoting behavior. So, at last the person is getting the self-efficacy or the personal capability to organize and execute a health promoting behavior. So, after we give health education to the person or an education about the dietary practices and exercise, the person is feeling like, yeah, yes, I can do it. That is a perceived self-efficacy. So, perceived self-efficacy influences perceived barriers to action. So, higher efficacy result in lowered perceptions of barriers to the performance of the behavior. So, for example, we were talking about the example of the person with myocardial infarction. So, the perceived barrier to action, like perceived barrier for exercise, maybe it may be the time. But if the person is capable or if the person has a higher self efficacy, then he will not concern about the time factor or other environmental factors. Moving further, activity related affect, that is defined as the subjective positive or negative feeling that occurs based on the stimulus properties of the behavior itself. They influence self efficacy, which means the more positive the subjective feeling, the greater the feeling of efficacy. So, from the model you can see the perceived benefits of action, perceived barriers to action, then perceived self efficacy, and in that area you can see activity related effect. Activity related effect is what is the person's effect, whether it is positive or negative. Down you can see interpersonal influences. Interpersonal influences, it may be from family or peers or care providers, norms, support and models. Next is situational influences, that is the person's individual preferences or options, demand characteristics or the nature towards a behavior. So, here you can see in this area you can see the interpersonal influences and situational influences, and the situational influences you can see that is the, directly or indirectly influencing the health promoting behaviors. So, we are moving further to the third area, that is the commitment to a plan of action. So, within the behavioral outcome, there is a commitment to a plan of action, which is the concept of intention and identification of a planned strategy that leads to implementation of health behavior. So, after giving an education to the person about risk modification and dietary modification and exercise, yes, person is understanding or person is identifying or person is coming to a point to take some strategies or the plan of action. Yes, I will do that. Yes, I can manage my dietary regimen. That is the commitment to a plan of action. So, here you can see there are two terms, that is competing demands and competing preferences. Competing demands are those alternative behavior over which individuals have low control, because there are environmental contingencies such as work or family care responsibilities. Next is competing preferences are alternative behavior over which individual exerts relatively high control. So, from this model you can see at top it is written immediate competing demands. That is, immediate competing demands means like our client with post myocardial infarction, like every day he's going for some exercise, but he can't go for one fine day he can't go for exercise because of some environmental factors. So upon these environmental factors he has low control, but preferences, that is high control, he is somehow he is managing his time or somehow he is managing his schedule to do the exercise. So, and ultimately you can see the last point, that is the health promoting behavior, and it is the end point or action outcome directed toward attaining a positive health outcome such as optimal well-being, personal fulfillment and productive living. So our client is doing every day, he is doing exercise or 20 minutes exercise every day, and with the help of this behavior he is attaining an optimal well-being, personal fulfillment and productive living without any symptoms. So this is about our model. Hope you understood this. So we have seen the major areas and we have seen the major concept with the help of an example, that is the myocardial person. The person, hope you understood this. Thank you for watching. Thank you. Once again, I explain this model with our example. First is we are assessing the prior related behavior and the personal factors, whether the person undergone such type of disease or angina, or whether he took any health promoting behavior like exercise or dietary approaches, and how well he did it, and what are the personal factors, his biological like his age, his body mass index, his agility, and his health status and all, psychological factors, his self-esteem, socio-cultural factors, his race, socio-economic status and all. So after this the person is taking certain behavior and perceived benefits of action. With the help of our nursing intervention, the person is understanding the benefits of walking or dietary modification. Next is perceived barriers to action. What are the barriers? And at last he is achieving the perceived self-efficacy or capability to do that behavior modification in order to achieve well-being. And activity related effect, whether his positive effect or negative effect. And here also you can see interpersonal influences, that is the influence of family, peers and providers, and situational influences, how his perception or how his personal influences this directly or indirectly influences health promoting behavior. And he is taking some strategies, that is commitment to a plan of action, and at last he is getting doing health promoting behavior in order to achieve maximum well-being. Thank you for listening.